Na sasa tuelekee katika baraza la magavana ambapo wanazungumzia swala zima la msambao wa COVID-19. Tumpishe mwenyekiti.
Features will be complemented with the installation of additional plants. We call upon the partners to continue working with the county government to avail medical oxygen and infrastructure improvement in the health facilities. COVID-19 vaccination as at 1st August 2021, a total of 1,062,413 vaccine doses have been administered, which account for 21.1% of phase 1 targeted population. Additionally, a total of 661,314 people received the second dose of the vaccine, which accounts to 62.2% of the total vaccinated in phase 1. The vaccination rollout is as follows. For the first dose, healthcare workers, 174,965. Security officers, 91,081. Teachers, 160,000. Above 58, 361,292. Others, 325,071. For the second dose of vaccine, healthcare workers, 115,540. Security officers, 52,081. Teachers, 95,918. Above 58, 204,513. Others, 192,942. 542. We are glad to note that there has been a higher uptake of the second vaccine dose by the targeted population. We urge the national government to fast-track procurement and delivery of COVID-19 vaccines to scale up efforts so as to achieve the targeted vaccination coverage of 10 million. Home-based care. As at 1st August, there were 2,225 patients under home-based isolation care across the counties. In this regard, we urge all asymptomatic patients to continue working with the community health frontiers in the implementation of the home-based care guidelines. Non-COVID-19 pandemic issues, drought management, food and nutrition security in ASR counties continue to deteriorate, with arid areas severely affected due to the drought. The drought is expected to continue until February 2022. This, coupled with the impact of COVID-19, has threatened the livelihood of ASL populations. To address this issue, county governments are implementing social protection initiatives, which include cash transfers, supplementary feeding of vulnerable population, and 3, expanding water tracking to areas and institutions without water. Further, county governments are working closely with the national government, development partners, civil societies to mobilize resources to support the affected counties in order to scale up these interventions. Transport sector. County governments remain vigilant on the operations of public transport. We continue to tighten the measures imposed in the transport sector to curb the spread of virus. This has been done through ramping up hand washing and sanitation points in the buses and matatu terminals. Additionally, county governments have strengthened county transport safety committees. The committee is working with all the relevant stakeholders to sensitize the citizenry on the adherence of transport protocols. Gender. COVID-19 continues to widen the existing inequalities for women and girls and discrimination of already marginalized groups, including people with disability and those living with extreme poverty. In this regard, Counties have come up with intervention to caution the vulnerable groups from the effects of pandemic. Some of these measures include: 1. Setting aside special funds to caution them from the adverse socio-economic effects of the pandemic. 2. Provision of dignity packs for the women as well. 3. Sensitization of the public and the duty bearers on prevention and response to gender-based violence. 4. Medical waste management. We also note that there is still an influx of medical waste that is not disposed to in a safe manner. This continues to pose a great risk to the members of the public who interact with the waste materials. We therefore call upon all the county governments to ensure segregation of waste is undertaken at source. To enhance proper disposal of medical waste, such as personal protective equipment, we urge counties to provide well-labeled waste segregation bins and ensure compliance of Ministry of Health guidelines on medical waste disposal. 5. Water connectivity. Water is a key component in the fight against COVID-19. In this regard, we urge county governments to ensure uninterrupted water service provision in isolation centers and in all the public spaces. In areas with minimal water service levels, standby water tanks should be filled to guarantee constant water supply in order to observe the health guidelines on hand washing and hygiene. Now, we have a category here we are calling challenge. You remember that in June, we had a very good supply of funds from the National Treasury. Now we are in August. Finance. We note with concern the statement by the Controller of Budget to deny county governments access to funds as a result of pending audit issues. It is important for the Office of the Controller to recognize that approval on requisition of funds is based on County Government's Appropriations Act, and the oversight role is purely the mandate of the county assemblies and the Senate. We therefore discourage the Control of Budget on such attempt, as it would be overstepping the mandate of the Office of the Controller and disrupt service deliveries by county government.
Gavana Martin Wambora ambaye pia ni mwenyekiti wa baraza la magavana akitoa tu mikakati ambayo imewekwa na baraza hilo kuhakikisha makali ya corona yanakuwa ni yenye nafuu kwa Mkenya kule chini.